CAARN is important because all of the connections and partnerships we're able to create. If I think of what CAARN stands for, the C is community, the A's are aging and academic, the R is research, and the N is network.
CAARN have come together to really create what I call just the dream team. CAARN has been very instrumental in identifying researchers who have a strong interest in diversity, equity, inclusion research.
I have always done research either in pharmacies or in clinics or hospitals. And CAARN is out in the community. And for the first time, I had a group that said, you know what, we can help you make connections into the community so that you can do your work in the community. And given that I'm interested in working with patients and families and kids in the community, that was a very big deal. I thought I had to get to them through the healthcare system, and CAARN opened up my world.
CAARN is going to be the place that creates the evidence-based intervention, right? They're going to have the researchers and run a project just like you would on a new medication. They're going to make sure it works. Once they show that it works, that the evidence can show that it improves lives in functional ways, that it saves people money and healthcare costs. Once they figure that out, they come to us to help put those programs out in communities. Not just in Wisconsin, where we have 260 based providers, but now across the entire country.
The only way to reduce the disparities that we see in health is to not do them in silos and do research in our offices. We need the community to tell us that this is the right way to do things.
I have the opportunity to really engage in our community. I know the community well, and it's important that you are out in the community so you can be a trusted individual, a trusted person, that when someone comes to you to say, you know, I would like you to be involved in this research project on diabetes, on hypertension, and they trust me. They trust to know that I will not bring anything into our community that will harm them or hurt them.
Let's say you're living with pain. Let's say you live with diabetes. Let's say that you're afraid of falling or you have fallen, and going older feels scary and feels out of your control. We're going to take a program that we know works, and we're going to bring it to you locally. And you're going to meet with other older adults and a trainer. You're going to practice the evidence-based interventions that work, and you're going to see improvements in your life.
We see a lot of inequities right now. Like I mentioned, the only way to reduce these disparities and make us improve patient outcomes is to incorporate their perspectives.
You can go to our website, caarn.wisc.edu. You can find out about the projects we have going. If you're interested, there's a way to contact us. And you know, our goal is really to see that the more involvement we have from the people on the ground, the people in communities throughout Wisconsin, and particularly communities of color, the more we can have equitable health for all.